when I got pregnant with my first, I had been dieting for a number of years, and I remember feeling absolute panic about what it was going to be like to gain weight during pregnancy and how hard it was going to be to get it all off again. I remember wishing that there were programs that could help keep me in check and not fall off the wagon completely, even though I knew that weight loss was not a healthy goal for pregnancy. If this sounds like you, or you're just looking for a different approach to health during pregnancy and postpartum, I hope you stick around because this series will teach you all about intuitive eating during this unique season of life. Hello and welcome. My name is Tiffany Jensen and I'm a certified intuitive eating counselor, childbirth educator, child life specialist, labor and postpartum doula, and mental health counseling grad student. I combine all of these passions to bring you content that will help you navigate pregnancy and parenting with confidence and compassion. If this sounds up your alley, I'd love if you gave this video a like and subscribe to my channel. Let's jump into today's topic. This may or may not be surprising to you, but over 60% of women report body dissatisfaction during pregnancy and postpartum. Add to that the constant noise about all the food rules during pregnancy and postpartum and how much weight you're allowed to gain and how soon you have to get it all off. It's clear that we need a better approach to health. Fortunately, intuitive eating and a health at every size lens can help. In this series, we're going to dive into what that means. So like I mentioned in the intro, I so wish there was a group that I could join that was not focused on weight loss, but how to keep a healthy eating mindset during pregnancy. I think I even considered petitioning Weight Watchers to have like a not weight loss centric version of their program because I really craved the support and connection of that group experience. I desperately wish I had known about intuitive eating back then. It really is the non-diet approach to health that I needed for such a long time. I wasted so many years dieting, trying to make myself thinner, and then eventually getting to the point where I didn't expect to lose weight anymore, but I thought I had to stay on some sort of diet to keep me from falling into some sort of abyss, never to return. I realize now how rough that sort of thinking was. I lived that way before, during, and after all 4 of my pregnancies and births. And then, a number of months after my 4th was born, I heard of intuitive eating. The details are a little fuzzy, but I think I heard mention of it on a podcast, and then I heard a friend reference it, and my interest was piqued. So I did as I often do, and I dived in, soaking up all the information I could on intuitive eating, ultimately leading me to become a certified intuitive eating counselor. So you're probably wondering by now, what is intuitive eating? Intuitive eating is a non-diet approach to health invented by Evelyn Tribole and Elise Resch in the 1990s. The book is now in its 4th edition, and I highly recommend this most current edition because it includes additional information on how to raise children as intuitive eaters as well. Intuitive eating is an evidence-based approach featuring 10 principles that help you ditch the diet mentality, increase your physical and mental well-being, and help you be better in tune with your body. In this series, I'll go over each principle of intuitive eating, but I'll also take it a step further and share with you how it relates to pregnancy and postpartum, because in and of itself, it is not specific to pregnancy. Here are the principles that we'll be exploring. 1. Reject the diet mentality. 2. Honor your hunger. 3. Make peace with food. 4. Challenge the food police. 5. Discover the satisfaction factor. 6. Feel your fullness. 7. Cope with your feelings with kindness. Respect your body. 9. Movement. Feel the difference. And 10. Honor your hunger with gentle nutrition. We'll start today with the first principle of rejecting the diet mentality. So as we dive into the principles, something I want you to remember is that intuitive eating is not a linear process. We don't start with one principle and then master that and go on to the next. We all tend to need to take our time with each one and kind of come back and revisit different ones during unique seasons of our lives, and that's totally fine. That being said, this first principle of rejecting the diet mentality is a very solid place to start for all of us. This principle begins with really understanding how embedded diet culture is in our society and recognizing its harms. Once we are aware of this, we can work to really notice and reject when diet culture influences our thoughts and actions. On a personal note, learning this principle included a lot of grief for me. I'd always heard and known that it was hard to lose weight and even harder to keep it off. However, I always sort of told myself, well, even if I don't lose weight this time, I'm at least thinking about being healthy and not like falling into that abyss that I mentioned earlier. What no one ever told me is that it's the weight cycling itself, sometimes called yo-yo dieting, where you lose and then gain and then lose and then gain, that is harmful in and of itself. Studies have actually shown that it is weight cycling itself that actually puts you at more of a risk for heart disease and high blood pressure than being at a higher weight would have been. It is the diet that does the harm. In addition, 95% of diets fail. Full stop. If your healthcare provider recommended a medication that had a 5% success rate, but a really big chance of making things worse, would you consent to that medication? That's essentially what dieting is. And that type of recommendation to lose weight happens all of the time. I know learning these things can be upsetting, or at least it was for me. So if that's coming up for you, just try letting yourself feel that sadness and anger and know that it's okay to feel that and to take your time. I know for me, dieting was a way that I connected to others. I used to go to my Weight Watchers meetings with friends and family who I love dearly. I love my Weight Watcher leader, and I see the human side of all of this too, because diet culture is just so embedded in every aspect of our lives, it's hard to escape it entirely. I've found it helpful to allow myself to feel that sadness, the grief, and the anger, and just to go easy on myself. So once you do dive in, make sure to give yourself compassion, go slowly. It's also possible to have feelings of defensiveness come on like I did when you read some of this, and it's okay to put the information down for a bit and then just come back when you're ready. Intuitive eating is not a race. If, on the other hand, this fuels your anger in a way that makes you want to take down diet culture immediately, then congrats, I am so with you. Now, how does all this relate to pregnancy and postpartum? I certainly hope that no one is getting the advice to lose weight during pregnancy. So you might be thinking, this one doesn't apply to me since I'm not dieting while I'm pregnant. However, are you finding that there are an awful lot of food rules being thrown at you in pregnancy? Have you been warned about how much weight you're allowed to gain during pregnancy? Are you blaming yourself for something that happens during pregnancy and saying, oh, it's because I didn't eat the right foods, or it's because I did this or did that? These are all just sneaky forms of diet culture in pregnancy. Now, sure, it's true that some of the rules around food in pregnancy are about minimizing certain risks, and it's one thing to take a look at the reasons for the rules and weigh the benefits and risks for yourself. You may, for example, decide that you don't want to consume more than the recommended amount of caffeine during pregnancy, or decide to avoid deli meat because of the listeria risk. That's up to you, and that's just fine. You get to make those decisions. But when you're restricting food for the purpose of not gaining weight, too much weight in pregnancy, or even when it's like one of the few foods that you can stomach, you can quickly jump on that diet bandwagon during pregnancy, even when weight loss isn't the goal. And we see lots of this also in what Christy Harrison calls the wellness diet on her podcast, Food Psych. That's another great resource for learning about intuitive eating, and I'll link it in the description box. Now, during postpartum, rejecting the diet mentality is also helpful because we all too often hear that we need to be in a rush to get our bodies back and to lose that baby weight. Diet culture will single-handedly rob us of the celebration and the miracle of what our body just accomplished in giving birth. From elation-filled births to difficult and traumatic births, You and your body are worthy of love and compassion. Your body needs and deserves however much time it requires to recover well. Don't let diet culture steal that from you. I hope you learned something in this video and will join me in the next one. Each of the 10 principles will have its own video, and up next is Honor Your Hunger. Make sure you hit that subscribe button so you don't miss it. Until next time, may your cup be filled with self-compassion and confidence as you navigate this wild parenting life.